Executive. We have the Arizona Peer and Family Coalition Executive Director Christina Sabetta with us today. And we have Kelly Cabello, who has also been very much helping us with the updates and reports and newsletters regarding Arizona legislation around behavioral health. So they're going to discuss bills that have been passed through and signed by the governor, as well as those that have failed. And as well as that, provide us with an overview of the state budget. I will, with that said, turn it over to Christina and Kelly.
Awesome. Thank you, Lori. And Kelly, thanks for joining us here at the last minute.
No problem. Good morning.
I just wanted to make sure I'm not missing anything here in chat. Okay. All right, Laura, you'll let us know too if we miss anything in chat.
Will do.
Okay, so good morning, Monday morning. The legislative session went back today after a very long time being away, but we're hoping that today is their last day. Kelly, have you heard an update on that?
I have heard nothing.
So hopefully today we're going to have sundial, which means the legislative session will end. As you know, this has been a very, very, very long legislative session, and we've had a lot of information to weave through. Just wanted to quick share about the Arizona Peer and Family Coalition. So as many of you know, and if you don't, we are a statewide mental health advocacy group. We are focused on, we advocate on behalf of peers, individuals with lived experience. That could be students, that could be young adults, that could be the SMI population. We are the advocacy group for those individuals. And we all come to the table identifying ourselves as a peer, family member, or ally, meaning that we make sure that we're advocating, again, based on what's best for peers, what's best for family members, and then to really be inclusive and partner with other groups who don't identify as a peer or family member. We include allies in our process as well. So this has been a exciting roller coaster, this legislative session. And so I'm going to pull up our handout here of the legislative summary. Just get it up for you here. All right, can everyone share my screen? Can everyone see my screen?
Yes.
Okay. All right, so summary of bills. Graphic credit to Kelly for putting this PowerPoint together. So thanks, Kelly. All right, lots going on. So there was 1,528 introduced bills. 809 of them came from the House, 719 came from the Senate. We had 104 memorials and resolutions, 59 came from the House, 45 came from the Senate. So 1,528, as you can see, that's a lot of information. That's a lot of bills that are brought, that were brought towards us in this legislative session. The one great value that the Arizona Peer and Family Coalition can provide their members, which on a side note is free to become a member of our organization. What members get that non-members do not get is our weekly legislative updates. So if you're interested on this topic, want to keep up to date with what's going on, let us know, throw your email in the chat, and we'll make sure to get you signed up. Again, you have to be a member of the organization to get these weekly legislative updates. Obviously, this is a special event where we're presenting for Mental Health Monday, which is why you're getting this information today. One thing I also want to say about that is we use Lola, which is an online software that helps us weed through a lot of this information. So it's not that Kelly, Eddie Sissons, and I are going through all 1,500 bills, but we can search by any specific language that comes up, that pops up. What we like to do is we like to be ahead of the game. We like to be in the know. We like to be at those tables so we know before a bill's going to drop. And so that's what we're sort of doing right now, is talking to folks about, hey, what are we looking towards for the 2024 legislative session? Because now is when folks are really having those conversations, as we are as well. All right, so 1,528 introduced bills, 156 bills were sent to the governor. 93 bills have been signed by the governor, 63 have been vetoed, the most in state's legislative history. 1,372 bills in limbo, 19 resolutions sent to the Secretary of State, and we'll discuss one of them right after this, and then 85 are in limbo. Again, here, just want to mention again the hot list. Yes, Kathy? Kathy, you're on mute.
Lenore is trying to get in, but the link won't work for her. Can Lori send another link?
Yes, and I did, if you want to tell her to look at my email, I did just send her a link as well. I will resend it.
Thank you.
Have her check her email. Thank you for letting us know.
Let me get my screen back up here. All right, sorry about that. Let me get my screen back up. All right. So again, we call the bills that we monitor on a weekly basis are what we call our hot list. And so we monitor them based on whether we support, oppose, are monitoring them, or we remain neutral, we're asking questions. And the main reason why we sort of select support, oppose, and neutral is when you log in on the request to speak system, which I'm not sure, I'm looking at the audience now, I'm not sure if folks have had a chance to do that or have done that in the past. Has anyone used the request to speak system? Trish or Brissa?
No,
Veronica, Rochelle? No. Well, what I'll do is after the presentation, I'll share a quick short video on how to use the request to speak system. I can't walk you through that system and show you how to sort of support or oppose a bill right now, because there's no bills that are being on the agenda for a specific committee. So a bill has to be on the agenda and has to be heard that week in a committee in order for you to use the request to speak system and comment on a bill. But I'll show you a short video here after the conclusion of this presentation, so you have a better idea of what that looks like. And so we will go in and use the request to speak system. One, as individuals, you can use that system, and two, also lobbyists can use that system as well. So I am a registered lobbyist for the Arizona Parent Family Coalition. I will, when the organization decides or the coalition decides how they want to stand on different bills, then we decide whether or not we're going to support, oppose, or remain neutral. But you can also do that as an individual. What's really important about that system is those comments follow the bill throughout the legislative process. So if you have questions, if you have concerns, you can add that content to that bill, and that's followed through the legislative session. All right, so, and feel free to, we have a small group, so feel free to raise hands or plug a question into chat, and then Kelly and I will do our best to answer that. So we have one here that we recently added. It's a Striker, it's SCR 1001, and that's a Senate concurrent resolution. What's interesting about these resolutions is they don't have the authority of law and they don't need to be approved by the governor. And so in this situation, this is ready for the Secretary of State. So it's a way to sort of emphasize control of the legislator, their viewpoints, where they want to go on something very specific like this. And so here in this specific resolution, they're talking about providing better resources to law enforcement and implementing strategies to reduce violent crime. Kelly, do you want to say anything else about that concurrent resolution?
About this for DOC?
Yes.
Yeah, I really should have paid more attention to that one, I think. When did When did they do this? I probably even put it up there. I am
Yeah.
concerned with DOC having full reign over the nonprofits that they contract with, just because recently I've seen firsthand what those places are like. And I don't know that DOC would be the best candidate to administer their own grants, but that I'm sure more information is going to come out before the election.
Yes. Yeah. So stay tuned on that. I think there's some very valuable items in this concurrent resolution that will be helpful as we move forward and do our best to provide alternative options and reduce some violent crime within our state. All right, let's move on to House bills. Again, Kelly, feel free to come off of mute and chime in at any point here.
Okay.
I'm going to move right to 2019 here. House Bill 2019. Again, you see the HB in front of it. That means it was introduced by the House first. So if it's HB, it's a House bill. If it's SB, it's a Senate bill. So we're going to go through the House bills first. And so this law here that was signed by the governor is in line with the Permit Freedom Act, which would, if someone is looking to, say, build a tattoo shop or build a multifamily home, the city or municipality can come back and say they're not allowed to, right? And so, but a lot of times the language is very vague and ambiguous. And so we're really asking, this bill is really asking for them to be very specific on, if you can't build a multifamily home, why not? And what can you do to ensure that you can build a multifamily home? If you can't put a tattoo shop there, what can you do? So it'll help both with folks who are trying to build additional housing within our communities, as well as folks that are wanting to expand and build businesses within our communities. House Bill 2041, this may be something that I know Bea has presented on this bill to the Northern Arizona Peer and Family Coalition in the past. This bill is something that has been very controversial within our coalition. This bill allows, it increases the time for a behavioral health provider to pick up the voluntary evaluation from 5 days to 10 days. And I'm sure many will agree, we all want folks to get services and that evaluation as quickly as possible. So a little concerned about how this will play out. But we will see. So we'll be keeping a close eye on that. House Bill 2166 allows behavioral health homes that are operating in Arizona. They're required to be licensed by the Department of Health Services. And so this is something that we've been monitoring. We're keeping a close eye on, and it was signed by the governor. 2168. And you'll see here on the right where we have the support, oppose, or monitor, or neutral. There's been some bills where we're just not sure about, but we had a lot of questions that we wanted answered. So Good Samaritan bill really allows an individual who's using a controlled substance, if the evidence protecting an individual who helps someone with a drug-related overdose. And we want to make sure that those Samaritans are protected and taken care of in this situation. That bill was something we supported, and it was something that was signed by the governor. 2194 establishes a 20-member drug overdose fatality review team, which will be great in the Department of Health Services. That review team will be responsible for developing drug overdose fatalities collection system, making sure they're collecting that data, develop protocols for drug overdose investigations, determine statutory and regulatory changes needed to increase the incidence of drug overdose fatalities. That bill was, let's see, signed by the governor. 2026. Oh, Kelly, did you have something? Hi, Tyrus, welcome.
No, not yet. There's nothing really exciting yet.
Right. I mean, some of this stuff isn't very sexy. But let's be honest, it's informative and it makes it our system for sure, right? Welcome, Tyrus, and I think I saw someone else join us. Welcome. All right. House Bill 2226 would appropriate $5 million to the general fund for the newly established fentanyl prosecution and testing fund. It would be allocated on a first come first served basis to county attorneys, sheriffs, and courts to reimburse costs related to fentanyl prosecutions. There has not been movement since March, which we feel is a good thing. We really support a public health response versus criminal justice response to the opioid epidemic. And so while usually more money is a good thing in this case, we'd rather see it on the front end, see it as a public health response versus being done in the criminal justice. We also, based on research and data, do not feel as though justice interventions are effective or appropriate to mitigate substance abuse in this situation. So this bill was something we did oppose, and no movement has happened since March. 2333, no action on this bill. This would have put $10 million to ADOA to be distributed to our rural counties here. We were in support of that, but that did not move very far. Again, no action since March. House Bill 2336. I got Stephen who's coming back. We were in support of this bill. This would allow a community college to provide a tuition waiver scholarship to the child or spouse of an Arizona resident. Unfortunately, there was no movement or action on that bill since March 28th. So that may or may not come back next year. It would be great if it did. 2341. 2341 would, so each student here would get additional funds if they were enrolled in another combination school program. Our concern with this bill is, again, we want folks to get educated no matter whether they're in jail or not in jail. We want folks to get educated. But with this bill, at first when this bill came out, the language was not transparent. There was no appropriation. They didn't mention specific amounts that would be allowed in this bill. And so it made us nervous. So it's something that we did sign in as neutral, and we were able to ask some questions, and we have not seen action on that since February 28th.
Hey, Christine, on that one, the accommodation school is a strange school. I thought it was for special needs students, but there's schools that are on military bases. So that was an interesting fun fact that I just looked up, I don't know, a week ago or so. So that was another problem with that one.
Interesting. Okay, Kelly, thanks for that. Thanks for that. For making a note of that. 2504. This is a bill that sounds, like a lot of these bills, they sound really good at first, and sure, we support education and we want our foster students to be taken care of. But in this case, we support public education, of course, but there's really no additional benefit for this bill, because students are eligible for an empowerment scholarship grant through the Department of Education. So we didn't see any benefit. There would be no additional benefit with this bill here. So we did oppose the bill, and it was vetoed by our governor. And Kelly, I know you know these scholarships well. Do you have anything to add on that one?
No, I mean, I think you put it very well. There would be no benefit for the students. The tuition organizations would benefit from it because that's how they make their money. I was actually surprised to see it because of the voucher expansion. So yeah, sometimes it is difficult with any legislation. You really have to read it about 80 times before you can get like the true meaning.
And, I always explain, right, to people who are sort of new to advocacy and understanding of our political climate, like we all sort of know we don't have a whole lot of extra money sitting around, right? And so it's hard to sort of support some of these bills that come through where there really is no benefit for the end user, which is the individual, the student, the individual with mental health issues, et cetera. So that's where we really have to sort of do the digging and weeding through things at the end. Senate Bill 2624 requires access to issue decisions on redeterminations for all members who have not been redetermined for eligibility since December 1st of 2022. That was signed by the governor. House Bill 2705, school safety training, appropriates $10 million for the general fund to ADA for the program, for the school active threat response pilot program. This is a bill that we did oppose. We support safety programs, we support comprehensive school-based safety programs, but we don't feel like this program is either one of those things. It restricts.
It was not. It was not even close to anything that that the Department of Ed has traditionally supported. There was funding in there for military combat equipment and all kinds of stuff that was just bananas. It was floated by the new superintendent who has different ideas about what school safety should look like. But this was a bit extra and over the top.
Thanks, Kelly. And I think the other important piece here to notice is that only school resource officers and juvenile probation officers would be funded through school safety programs. And it would remove school counselors and school social workers. And so our whole coalition believes very, very strongly that we need as many school counselors and school social workers in the schools. Again, school counselors provide that academic support, school social workers, psychologists, therapists provide that emotional behavioral support. We don't get that from probation officers or school resource officers. So definitely something we opposed, and thankfully there was no action on that since April. All right, Senate bills. 1036. This would, got a lot of people coming in and out, maybe connection issues this morning. This is really one of those bills where it was signed. We did oppose it. We support smart justice initiatives, but we stand, and we also really support second, third, fourth, fifth chances, right? Especially if we know someone is working their recovery, working their treatment. We want them to make sure that they get an opportunity to be involved. And so this legislation doesn't just address disparities in sentencing, and there are no exceptions for people who have disabilities or mental illness, which is another unfortunate thing. So this is something we did oppose and something that was signed by the governor. We didn't get everything we wanted this session. All right, hey, we got Lenore coming in now. I'm going to move on to Senate Bill 77 or 1077. This allows right, normally you have your mental health evaluations are to be done by a mental health treatment agency. And so for the purposes of court-ordered mental health evaluations, they expand the definition of evaluation agency to include a facility that is exempt from licensure as a healthcare institution, but opposes accreditation from another National Commission on Correctional Healthcare or American Correctional Associations. We really believe that there should not be an exemption to healthcare institution. We want to make sure that our best providers are providing the best care. We want to make sure that they're licensed, that they're credentialed, that all the boxes have been checked. I know some of this has been happening down in southern Arizona already. And so in some ways, this bill sort of aligned with some of the practices that are occurring down south. But it's not something that we were in support of, but it was signed by the governor. You know, again, I think the only other thing I want to add here is that court ordered evaluations shouldn't fall under the jurisdiction of criminal courts and corrections. They're not the expert in this space. So let's make sure we have our mental health evaluation and treatment agencies really providing this work. Kelly, did you have anything to add to that one?
Yeah, just because, I mean, I think they're still trying to hammer out the terms of the lawsuit with the private healthcare company and this DOC. I think the lawsuit's been over 10 years, but this, it's just less transparency. And we're already paying like $500,000 a year in legal fees resolving the mental health, access to mental health care in jails and prisons. So this bill does nothing to support appropriate and adequate care. So that's it.
Great. Thank you, Kelly. All right, Senate Bill 1081. This extends access through July 1st of 2029. Great thing. This has been signed by the governor. Senate Bill 1091. This is something, again, we oppose, and it would allow non-contracted private or nonprofit behavioral health providers, non-contracted providers to provide eligible inmates in its prisoner transition program with transition services. Again, I think we all feel that folks could, we want to make sure that there's care, compliance, and oversight with all these individuals that are providing this level of care. Go ahead, Kelly.
We just had a big, I don't even want to call it a scandal, a crisis with the sober living homes. So why would we want less oversight?
Yeah.
The problem with a lot of these businesses are that like no one's really paying attention, and just as involved individuals always don't get a fair shot, and there's always people that want to come in and provide less and take more. And the halfway houses and the reentry services are to support people so they can transition back successfully. And if they're not providing the services, then we're all at greater risk. So it's these kind of things are very concerning, and I'm glad the governor vetoed it.
Yeah, thanks, Kelly. I think, you know, your point with the situation with the sober living homes and our Indigenous populations, that's a huge, hopefully a huge wake-up call for our system. I know we've been hearing from the governor's office that they're not going to fund any additional new programs or whatnot until they really investigate all of our services and ensure that there's not additional fraud being had. And an example of where situations like this could fall. When there is no contract. And we also talk about, you know, all of our contracted providers already lack some oversight and accountability from access. So this wouldn't make it this would complicate things even more. All right, Senate Bill 77, or I'm sorry, Senate Bill 1177. This would require an emergency responder to provide a written document that includes a list of specified information about the resident who's going back to an assisted living center or living home. This was a bill that originally had mental health language in there as well. And so we were concerned about the stigma that was involved. We know and advocating for peers that's that's not something they want shared, their diagnosis, the medications they're on, et cetera. And so once the specification for the mental health population was removed from this language, we did decide to support it. We work closely with some of our advocates with Arizona Age, and this was something that they were in support of and really wanting to see. And so now that language was removed, we did support it, and it has been signed by the governor.
I just want to clarify that was 1157, not 77. 115.
Thank you, Lori. All right, 1186. Let's see, this one gives the parent additional rights here, including the right to be informed of the specific complaint or alleged against the person, the right to refuse, cooperate with the investigation, or receive child safety services offered, and the right to deny the worker entry into the home. So it really empowers, gives more rights to the parent, which in some situations may be helpful, may not be helpful. This is something that we monitored and weren't really sure about, but it was signed by the governor. This one will be something that we'll be anxious to see how it plays out within our child welfare system. Let's see.
Do you want me to take this one? It's a little bit in the weeds.
Sure, Kelly.
Well, it sounds like great to have a team get together and decide the child's educational best interest, but we don't have the authority to do that. The federal law states that parents always have educational rights until rights are severed. So trying to even pass, if it did pass and it did get signed into law, and of course I love the team approach, but those are rights that we can't make a decision on that because it's federal law. Even if until rights are severed, parents have educational rights. So that was the opposition to that.
Thank you, Kelly. And that bill was signed. Senate Bill 1220 would have developed an Alzheimer's disease state plan to assess Alzheimer's disease and dementia in Arizona. This did not have any action since March of 23.
Yet. It's not shipped yet. All right. It's not coming early. Well, no, not necessarily. It's just money.
It's also something that we were in support of, and we may see again next year.
Just to note, there is money in the budget, though. So maybe the bill didn't pass, but money was appropriated for Alzheimer's.
Yes, great point, Kelly. Thank you very much for that. All right, excellent. Senate Bill 1290 requires Department of Corrections to assist individuals in obtaining state issued IDs or driver's license. We did support that. That was signed by the governor. That's very important, especially when they're being released at 2 o'clock in the morning without anything. Let's see here. Senate Bill 1315, Kelly Carbello. This was her bill. This requires school districts to include students with disabilities in their emergency response plans. So congrats, Kelly, on getting that bill through the legislative process and signed.
Thank you so much.
Senate Bill 1331. This one's pretty short and sweet. We do not believe we need more guns on campuses. We believe we need more supports on campuses. And so, while unfortunately this did pass through the legislative session, it was vetoed by the governor. I still get anxious talking about that bill. All right, Senate Bill 1413. Pardon the some of the graphics in here we need to fix. Senate Bill 1413, again, something we would have posed, but it would allow if there was an existence of a homeless encampment, it would allow this county or municipality, they're required to notify the owner to remove the owner's tent, structure, other personal property. If it's not removed within 24 hours, They can retain the property. The other big item here is persons living at the encampment who are engaging in illegal drug use are guilty of the appropriate drug-related offense. Again, this is something where we support humane interventions. We want to understand why someone is there. We want to take a look at what they need. It might be a roof over their heads, not an additional fine or violation. So again, that's something we were strongly in opposition to, and thankfully it was vetoed by the governor. Senate Bill 1609, transitional housing. This would, let's see, this would, DOC is authorized to enter into a contract to provide transitional housing services for inmates only with a state licensed facility. So again, they have to provide it with a state licensed facility. We were in support of that, and that bill was signed by the governor.
So for anyone who follows private prison stuff, that bill was important because the president signed an executive order to get rid of all the private prisons. They're supposed to all be phasing out. So what was happening was that the states were then contracting with the private prisons, or the cities or the counties, so they could keep them anyway. And a lot of private prison agencies are now moving into transitional living centers. So this protects the residents or future residents from the problems with private prisons. So there would be oversight, and that's why it's important. Okay, sorry, I've been following this a bit too closely.
Thank you very much for adding that. That's important. Thank you for doing that. Oh, Senate Bill 1710. So if you get our action alerts or our weekly updates, you probably have seen a lot of information coming up from us on this bill. This is a bill that, as for those of you that don't know the coalition, we are a very collaborative group. We want to hear both sides of the story. We want to understand what's working, what's not working, and how we can come together to fix the issue. However, we also have individuals who, just a handful of individuals who really want to see secure housing, see additional folks receive services at ASH. And so the concern with this bill was a number of different things. This bill would have, someone else entering the waiting room here. This bill would have removed the Maricopa County cap. So right now there's a cap that Maricopa can only use so many beds, right? And making sure that our rural communities can also access those beds. Last time we checked, now those beds are full. So there are no available beds, but this would have removed the cap without having any kind of additional cap. It didn't extend the cap, it didn't increase the cap, it simply removed the cap, which could have led to further institutionalization of folks with mental illness down the road. And so we are very, very fearful about that. This group that ran this bill were not wanting to hear our thoughts on that. So initially we did remain neutral with hopes that they would invite us to the table, that we could have a conversation. But those conversations weren't had. This bill also includes a governing board. And so it would, rather than having ASH being administrated by the Department of Health Services, it would now have its own governing board of 5 members. This may be helpful, it may not. We don't know. But again, the concern is a part of the bill that there's been a lot of political talk, a lot of articles as of recent about how horrible it was that the governor and advocates didn't support this governing board for ASH. But again, we don't know if that would have helped ASH. We don't know if ASH would have been in a better situation with a 5-member governing board. We're going to see more bills like this. We're going to see more bills coming through. The scary thing is that these individuals who really want to see these changes also believe in secure housing. So little concerned about that, continuing to watch it. But we give ourselves a lot of credit on this bill. We've been in conversation with our legislators in the governor's office from the beginning. And so it was at about the 11th hour that Montenegro came forward, put an amendment on this bill that would remove the Maricopa County PAP and remove the 5-member governing board language. And so it was amended to allow 1 PhD and 1 postgraduate mental health professional to provide evaluations in counties with less than 50 people, or I'm sorry, with less than 50,000 people. This will help rural communities. Again, we have a pose on here. It was something we posed, but then when that amendment was added at the 11th hour, I mean, literally 11 and like 3/4 of an hour. Once it was added, then we were in support of governor signing the amended bill. And so she did. So we have some protection. We really feel like we need to fix ASH first before we put more people in there. We've been hearing a lot of course, horror stories. We see the horror stories in the news. We hear the horror stories when folks testify and the issues at ASH. We don't disagree that aren't getting the quality of care that they deserve and need at ASH. But we do worry if things are that bad at ASH. We do worry that we put people in there before we fix the issues. So let's fix the issues and then we can discuss the number of beds there. All right. I'm going to stop sharing my screen right there and see if anyone has any questions.
I had a comment about the ASH bill, the
Sure.
governing board. One of the things that we're working on is addressing the worker shortage. A lot of the problems have nothing to do with governance, but just the fact that there's not enough staff at the hospital or in the community. And we think that resources should go to our treatment, our entire system. There's 400 people max at the state hospital. There's 50,000 in the community. So that's where we would like to see our resources as the community system. Sorry.
No, Kelly, don't ever be sorry. That's why you're here. Thank you for sharing. And the other important thing now that we'll discuss as we go through the budget, Arizona's budget for 23 and 24, is that there is money in there to help support ASH. And so we'll go through that here in a little bit. The governor's office has brought all the advocacy groups together, as well as our intellectual developmental disability advocates. We've been working very closely with them. So we are at the table, the governor's listening to what we have to say. The governor is not in support of secure housing and locking folks up when they could receive services in the community that are much less restrictive. So it's a process, it's a journey, but what we do need to figure out is how we're going to fix things on the front end so we can avoid stays at ASH altogether. Anyways, we could go on for a day on that bill, but let me pull up the budget here. We're going to go through that next. All
And
right.
you wanted to do the RTC at some point.
Yes, I will. I will just touch on some of the bigger things here that I think are very valuable. And Kelly, again, chime in here when necessary. So there's some good things in this budget. So you'll see here, and we'll send these documents out so everyone has them in front of them. Here we have expanding care from 200,000 or 200% to 225% of the federal poverty level for 5 million in 2024 and 6.6 million in 25 and 26. If CMS approves, it could add FTE or 4 FTEs for advisory council on Indian healthcare with $0.2 million, which would be helpful as well. We did see here that $10 million was removed for unbuilt secure behavioral residential facilities. As I mentioned with Senate Bill 1710, we have a number of advocates who are that were supporting that bill who are also in favor of secured behavioral health facilities, again, locked secured. They got money allocated. However, those facilities have not been built or not being utilized. And so that money would have run out, I believe, in July of this year. And so it was removed from the budget. Allows 4.2 for critical access hospital supplemental pool. Again, I'll just cover some of the big things here. Reverse 225 million for unsecured behavioral health residential facility capital funding. Again, same as secured residential facilities up here. 0.8 million for chiropractic services increase. Increases in newborn screening fees. DES as 80 full-time equivalent staff for visitation aides. It's a big win. Funding for new vehicles, adds one-time funding for 12.6 million for extended foster care comprehensive service model. One-time funding of 2 million for lost adoption incentive federal funds. 4 million for a positive parenting program for post-permanency placements. Folks, we love our pilot program, so we'll keep a close eye on this program and hopefully it does well, and maybe it's something we could see funded then later. Let's see here.
I have to run at 11, but I wanted to say that this year was, we put more money into housing this year than in the history of our state, which is important because we really need it to be there right now. So
Yes.
with that, I have an 11 o'clock. So thank you for hearing me, and I will talk to you later.
Kelly, thanks for being here. All right, perfect. And I'll move to the housing here. I think housing's at the end. I'm not sure how they got plugged at the end. I guess we're going in alphabetical order. DES, let's see, we have 10 million for homeless youth assistance funding, which is great. 5 million for elderly housing assistance, 9.1 million for Victims of Crime Act. Let's see, productive incentive program, the food bucks, got an increase there. 0.8 million for Graham County Rehab Center. 0.25 for Glow Miami Area Food Bank. 1 million for diaper and incontinence assistance. Here we go to DHS, so State Hospital increases funding for ASH by $1.1 million. Again, we all agree we have issues at ASH. We all agree ASH needs some attention. The governor agrees with that as well. Provides 5.6 million for ASH operating shortfall. Adds 3.5 million for updated security system at ASH. So again, we're looking at increasing ASH contract by 6 million. We got some additional money in here for fentanyl testing strips. As Kelly mentioned earlier, we got $500,000 for Alzheimer's disease research, 0.75 for dementia awareness campaign. So you'll see some of these things, right, as they go through the legislative process, they might start out as bills, but then they can be lumped into the budget at the end. 2.5 million for nurse family partnership program, 5 million for health crisis review centers and wraparound services. Hugely effective program. Let's see, 1 million for collaborative care model, integration. We know we don't see true integration within our system, and that definitely needs to be something expanded on. As Kelly said, this is the most money we've got for housing in a very, very long time. And I think, I just want to pause here for a minute, because when we look at those individuals who are on the streets, who are in our homeless encampment areas, who are struggling with substance abuse, who are struggling with mental health issues, who are talked about as being plugged into ASH to get services, some of these folks just need a roof over their head. And so they don't need restrictive settings. They don't need necessarily medication. They sometimes just need a roof over their head. And that's oftentimes cheaper than having someone live in an inpatient psychiatric facility. So really,
Christina, I'd like
Yes.
to say, I'm in the Cottonwood community, and our newspaper that came out on Sunday had an article on a hotel that is being renovated for transitional housing. And it was so good to see that. I get chills just talking about it. And it isn't just the housing, it's a 2-year program with case management, et cetera.
Awesome. Thanks, Lori, for sharing. It is really exciting to see what communities are doing with those vacant hotels. Thanks for sharing. So here again, big win with housing, expand housing trust fund by 150 million. The great thing about the Housing Trust Fund is there's not as many restrictions on that money, and people can get very creative, like supporting hotel renovations. So that's a huge win. I think when we started advocating for this Housing Trust Fund, I want to say we were at 40. I should double check my numbers on that, but now to be at 150 million, the most money we've ever had there, which is incredible. 40 million for homeless shelter and services fund, 5 million for mobile home relocation fund, and then 1.9 for military transitional housing. You'll see some money here for Florence closure. You know, I'm not 100% sure, actually. I was gonna ask Kelly, but now she's off what this prison, private prison contract is for, but I can get back to folks on that. Establishes 5 million for reentry and transitional housing. Department of Education, we see some positive things here. You know, education is one of those areas that we need assistance in. And so we saw an adjustment for school funding from 2% to 2.9%, provides 3 million for schools to use this year, and then overrides the spending cap, which is also really great news and something we really had to push a lot on last year to override that spending cap. And that will go through June of 2024. Something that having those restrictions and having those spending caps on schools is sort of a legislative nightmare. And so it's something that we have to get overridden every year, or we have to change the language in there. And so it's been something that we've had to do every year for the last few years. All right, with that said, any questions?
No questions, but wow.
Yeah, I echo that. That was really cool to hear all that. I usually don't have time in my brain to take on all those pieces, so that was so informative and easy to understand. So thank you for that, putting that all together in an easier format.
Oh, good. You're welcome.
And I also really appreciate the work Kelly is doing too. She's adding another dimension to this. And I really appreciate her insight.
Yeah, absolutely. Well, and we're blessed to have Kelly be part of our team with the coalition. She likes to get into the weeds and figure things out. And she also comes from the IDD space and has been an IDD advocate for so long. And so she can sort of bring those two communities, bring those two advocacy groups together and help us sort of form some common language. But it's really been great having her on board as well. It makes it even more fun for me, as I don't always like the political gamuts.
I just want to thank you, Christina and Kelly and Eddie, the entire advocacy committee. This really demonstrates positive growth and influence on the part of the APFC as a whole.
Yeah, thanks, Lori. Thanks, Lori. And I agree with you. I think that, you know, for the first time in a very long time, the governor's office, the House and the Senate, you know, not all members, but some members are starting to see and recognize how helpful we can be. They're starting to recognize the importance of hearing our voices. And I think that I'm really excited for where we can go and the positive impact we can make on our system at all different levels. So it's an exciting time. It's a lot of work, but it's also a very exciting time. And, you know, the reality of it is to your point, Trish, providers, other advocacy groups, they don't have the time and the bandwidth to take on these issues, right? And so even, you know, when we talk about Senate Bill 1710, a lot of our IDD advocates did not even know that this bill was moving along. Right. And then they're like, wait, we are not sending more IDD folks to ASH. Like, no, they consider it a black hole. Right. And so they're like, what do you mean this bill is going forward? I'm like, yeah, it's moving forward. Like, we need to get on board with that. Right. And so that's something that we have really sort of found to be our niche and ability to find that need so others don't have to, right? But now we need to take it to the next step and really help bring this information to individuals and encourage them to use the request to speak system. So it's not always the same few people that are advocating on some of these things. So if I can, then I will just show quickly how to use the request to speak system. Oh, Lenore, you have your hand up. Lenore, do you have your hand up or are you just trying to cover me up?
You need to unmute, Lenore.
I thought I did. Okay, can you hear me now?
Yes.
Okay, sorry. I actually was only able to get into the meeting about halfway through, so I'll go back and watch it again because I need some review too. But what I was going to say is tomorrow I'm meeting with the very new president of the Nami Valley of the Sun. And what I'm going to charge her with, and she's pretty good at listening to me, is to have a board member from that NAMI board, or, well, I mean, I really think it needs to be a board member who is going to join the coalition and attend meetings, because the NAMI affiliates really, in my experience, do not have time and have not really gotten into their advocacy, which is 1/3 of what NAMI National and the associates say they're supposed to be doing. So, you know, we need to, we also have a new, a lot of changes with NAMI Arizona. And so what I will also do is contact some of the individuals leading that organization now and make sure that they are really joining the coalition. The more people we can get in, the better it's going to be with a lot of these issues, because they're all overwhelmed with what they're doing. But if they can tap into what we're doing and support us, it just expands our reach. So.
Yeah, absolutely. Thanks, Lenore. And for the Peer and Family Career Academy as well, too, right? This is something that we talked about the Academy maybe at some point wanting to do. And, you know, we know organizations are under a lot right now, and the workforce shortage is a lot. And so let us be that advocacy tool. We'll give you information. You can do what you want with it, but we'll send it. And so the more we can empower you all to sort of then sign in and use the request to speak system, I think the better it is. So thank you for those comments. Let me share my short video here. It's by one of my favorite people, Zeta D-Dolph, before she was the policy advisor for Governor Hobbs. But so you'll recognize her voice now and know that someone who's very informed and very passionate is now working within our governor's office. So I still got to use her video though. Okay, hold on. Let me just make sure I hit the sound. All right, can everyone see it?
Association. And we started a new series called What Even Is That?, where we discuss common ideas, trends, and other situations that we find ourselves in at the state capitol that might not be super accessible or understandable to people who don't spend a lot of time there. So today we're going to be talking about the Request to Speak, or RTS system. So what is the Request to Speak system? This system is a function of the Arizona State Legislature that allows you, a citizen, to weigh in on different bills and measures that are moving through the legislative process. It allows you to give testimony if you want to come down to the Capitol and do that, or if you want to just weigh in either for or against something from home and leave comments that legislators can see and have your voice heard. So there's one pretty big caveat about this system, and that is that you have to sign up and actually activate your account from a kiosk at the state capitol. And we recognize that that's a pretty big barrier for some individuals who don't live anywhere near Phoenix. So in order to remove that barrier, both of our organizations are willing to make that trip down to the state capitol for you. So in order to do that, we just need to get your permission. You can download a form at pathcoalition.org/legislative advocacy. You're going to scroll down to Rapid Response Team, take you to a Request to Speak sign-up form. All you have to do is put down some information here, and Shannon will get you all squared away with an RTS account. You can also sign up for a form on ACAA's website. That's azcaa.org/subscribe. And if you go down here to the bottom of the page, there's a button that says click here to download an RTS sign-up form. Shockingly, when you click that button, you get taken to an RTS sign-up form. And if you send that back to us, we'll go ahead and get you signed up for an RTS account. So once you have an account, there are two ways where you can access the Request to Speak system. If you spend a lot of time on the Arizona State Legislative website, like Beta and I are, you can go to azleg.gov, go under Bills for bill tracking, which will bring up a backdoor way to get into RTS. Otherwise, you can go straight to apps.azleg.gov, which will allow you to sign into your account. Once you get all your information in and signed in, it'll allow you to pick two different applications. You can either do Request to Speak or Bill Status Inquiry. We're going to do Request to Speak today. Once you're on the Request to Speak homepage, there's a couple of different functions that you can do. If you already know which bill it is that you want to log in, that you want to weigh in on, all you have to hit is New Request. From here, if you happen to know the bill number, you're able to put just that number in and search for that right away. But if you don't know exactly what the number is, but you know that it has something to do with child welfare, or it has to do with education or food insecurity, SNAP, you can put in some bill description information and it'll populate up different bills that we're looking for. So for the purpose of this, we're going to look up just one specific bill that we both know is moving through the legislative process right now. And this is the bill addressing the opioid crisis that the legislature is in special session on right now. So once you put in the number in search, it's going to bring up some information. It's going to let you know what date the agenda, like what day the bill is going to be heard in committee. It's going to let you know what the bill number and its title is. It's going to tell you what committee it's being heard in, what location, and then it's going to give you a little button at the end where you can add a request. And this is where you're going to be able to actually weigh in. So it's going to take you to a page where you can select whether you're for the bill, against the bill, or if you just happen to be neutral. You may have some comments like you're not sure about the legislation, you just want to leave some comments. You can leave comments regardless, and all of this information will follow this bill through the legislative process. Now, if you are able to come down to the Capitol and you want to testify, you can select yes at this point, and that'll give you an opportunity to speak before the committee. But if you're like most people and you're just going to do this from home, all you have to do is click no. Other ways that you can use the Request to Speak system is if you're not really sure what bills are happening right now, but you just want to see what's going on at the Capitol, you can click on upcoming agendas. And that's going to give you a list of all the agendas that are being heard, all the committee agendas that are being heard at the Capitol that week, and show you all of the bills that are being heard in those committees to see if it's something that you're interested in. Both of our organizations do a lot of work around economic equity, economic justice, poverty, the budget, voting rights, all kinds of issues. So if you're interested in any of those things, please feel free to reach out to us. We'd love to get you on our mailing list so you can learn a little bit more about when these bills are actually being heard in committee. We'll give you a heads up. And if you're interested in something else that we haven't mentioned, let us know. We'd love to put you in touch with somebody who does that kind of work here in Arizona. And we just wanted to say thank you for watching. If there's anything else that you
All right. Any quick questions on that? Hopefully that was a little bit helpful. The Arizona Peer and Family Coalition also has very specific trainings where we dive into that Request to Speak system a little bit more. And then again, when we're in session and there's a bill, you can't comment on those bills unless the bill is assigned to an agenda and is being heard in a committee that week. And so when that's being done, we do live trainings. I can show you exactly how to do that. And oftentimes we'll do that during our general advocacy committee meetings, especially when we want folks to advocate on something bigger. And I did want to mention Rochelle's work here. Rochelle, who are you with? Can I ask? Okay, well, Rochelle has a question, so I'm going to ask her. So, when we talk about lobbying and we talk about advocacy, they're both very, very powerful views, both very powerful tools. All lobbying is advocacy. So all lobbying that I do as a registered lobbyist is advocacy, but not all advocacy is lobbying, right? And so when we talk about lobbying, I'm talking about very specific bills or specific legislation, specific laws or policies that need to be changed. Lobbying where you as an advocate are sort of talking about why you don't support secure housing, or why you believe there should be more services in the schools, or why you believe there should be more money spent on housing. And so you can still do all that. I'm required to file many more reports. There's a lot of rules and regulations that dictate what I can and can't do. I can't have a big party at my house with a bunch of legislators without letting the public know that I'm doing that and filing a report with the state of Arizona. So there's a lot more restrictions on that. I do, from my personal standpoint, I think when you're advocating on behalf of a large organization, it's helpful to have a lobbyist, because that lobbyist can then go in on the request to speak system, sign in support of the coalition. They can speak for the coalition. I can go and testify on a specific bill and speak on behalf of the coalition. Kathy, Lori, they can go testify in a specific bill, but they can't speak on behalf of the coalition. They would have to speak on themselves, in favor of themselves, if that makes sense, right? They're representing yourself. So I can represent the organization. You as an advocate can only represent yourself. So a lot of provider organizations, especially your bigger provider organizations, do have registered lobbyists. Only that registered lobbyist can speak on behalf of the coalition, or I'm sorry, on behalf of their organization. So there's some pros and cons to both of it. I think that, Valley del Sol Community Health, Rochelle, you guys probably do have a registered lobbyist. I'm not 100% sure, but I'm thinking you might, Rochelle. But yes, if not, it's probably something to consider. Valley del Sol, many providers work with the Arizona Council of Human Service Providers. And so they have registered lobbyists who lobby on behalf of providers only, right? And so many times the coalition, because we lobby on behalf of peers and family members, we may agree with the council on many items, we may not agree on some other items, right? And so that's where it may be different. And that's where, as an advocate, you can speak on behalf of yourself on what matters to you, but you can't, Rochelle, speak on behalf of Valley del Sol unless you're the registered lobbyist. So really sort of dictates who you're advocating on behalf. That separates the two. All right, any other questions? Great questions, Rochelle. I'm glad you asked that. Any other questions, comments? I think the only thing, while I'm looking at Kathy and seeing what a powerful advocate she's been, and as you know, Kathy Basher is the chair of our coalition as well. The one bill 1710 that we had talked about regarding secure housing, which we feel could have been very, very detrimental to our community if that cap would have been removed. Kathy and George went and testified on that bill during committee. And it was really after that testimony and after the ruckus that we sort of put forward that people started to listen and question whether or not this bill was actually going to help or hurt our community. And again, it was Kathy's testimony and George's testimony who got up there and spoke. It's scary to do, right, Kathy? It's scary to do, but can also be very empowering, but also makes a huge difference. So I just wanted to share that. Also, just so you know, the Arizona Legislative azledge.gov, their website is actually pretty great. There's some things, of course, no government entity or website is perfect, but I think it's actually pretty great. And the reason I say that is because they do a really good job of tracking and making public any information that isn't aligned with that bill. So, for example, you can go back and look up Senate Bill 1710 and go back to find when Kathy testified on that bill and watch her testimony. You can watch all testimonies. So if there's a bill that comes up where you're like, gosh, is this going to help our community or is it going to hurt our community? I'm just not really sure. Or if I see on the request to speak system and I see, you know what, I wonder why, let's pretend Family Involvement Center has a registered lobbyist. I wonder why Family Involvement Center is opposing this bill. There's got to be a really good reason. I'm going to reach out to FIC and find out why, right? It can be very, very educational as we go about and advocate on some of these pieces. So if you ever want to learn more about how to sort of access and navigate those websites, we're happy to do that as well. Because again, all that information is there, and they do a good job of recording it, tracking it, and making sure it's uploaded in a fairly quickly, pretty quickly time. All right, well, I guess that concludes my presentation. I hope this was helpful. I think in some it was a very, chaotic, difficult legislative session, but we also have a lot of victories that we can celebrate, a lot of additional funds for some of those services that we have really been supportive of, especially when it comes to housing. Our three main policy priorities this year were housing, mental health in schools, and prevention. And so huge victories in housing. We'll now be surveying our members in the next couple of weeks here on what around mental health in schools and prevention would be beneficial for us to advocate for and focus on for this next legislative session. So thank you guys for having me. Thank you for being here. Thank you for caring and understanding how impactful it is to, really have our voice be heard, and know what's happened throughout the legislative session. So thanks for having me.
And thank you so much, Christina and Kelly, for who did have to leave early. As far as announcements, we have the NAPFC monthly meeting on August 15th, Wednesday, August 15th. We always meet the third Wednesday of the month from 1 to 2:30 in the afternoon. If you aren't on the mailing list for that, I have just put the email link in the chat for you. Our next Mental Health Monday is always the last Monday of the month, and that will be August 28th from 10 until 11:30. And I don't know what our topic is. I think we're working on that.
Yeah, we don't actually have a topic. So if anyone has any thoughts, ideas, throw them out.
Okay, any closing comments from anyone? Kathy, you've been quiet. I'm going to put you on the spot.
Okay, well, there is one thing that I'd like to share. NAMI is really backing this OIFA 3.0, and it's coming up in Cottonwood. And so I'm asking everyone, I'll send it out to you guys, if you please share it with everyone. Trish, anyone that's up here, let's really push it and get people there.
That's August 25th at Spectrum in Cottonwood.
Right.
Yes.
Yes. Thank you so much, Kathy, for mentioning that. Because when I was looking at the registration, we have folks registered from Spectrum. We have a lot of members from Spectrum, but so far that's it. So we definitely want to increase attendance there. Thanks, Kathy, for doing that.
All right. Anything with anybody else? Well, it looks like you're going to get a couple of minutes back in your day that you might not otherwise have had. Thank you, everyone, for being here. Have a wonderful day.
Thank you.
Thank you.
Thank you.